Hi, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. Today's topic is when selling a dental practice, be aware of the importance of the good guy clause. We'll get into this in a few moments. So we're now in 28 states selling practices. We've been doing this for 13 years. I was a dentist for 25. We have 10 employees, including 2 CPA accountants, one of the few brokers that have that many, that have a CPA accountants on staff. So we're here to assist you. We're now available to you from 8 a.m. till 9 p.m. every single day, except Christmas and Easter. Excuse me. So, our phone number is 201-663-0935, and our website is dentalpracticeguide.com or nationwidedentalpracticebrokers.com. So, feel free to give us a call. We're here to service you, buyer or seller. Even if you have just some questions you want to chat about, give us a ring. We'll be more than happy to talk to you. Now, the information we're about to share today is all for entertainment purposes. It's not legal or business advice. If you are thinking about selling to a DSO, and you're large enough, 1.6 million and higher, 6 chairs or more, please give us a call. That's a changing landscape with them right now. There's consolidation. Some are having trouble getting funding, all because of the interest rates going up. So it's very different from 22 and 21, where you saw these wild numbers being thrown out for purchase. Those days are over. Some of the big DSOs are not even buying single practices anymore. So it's changing. So give us a call. We'll talk to you about that. When I work with, when we pull a DSO in and we work with them, we're independent. They will often pay our commission. So there'll be no commission to you under most circumstances when dealing with the big DSOs. Also, if you're thinking about selling to a DSO and you work with our team, often we can get your legal fees reimbursed upon successful closing, depending on certain criteria, of course. So please call us, we can work with you. Let's talk about this good guy clause. A good guy clause is in your lease. And when you, even if it was 40 years ago, 30 years ago, you don't own your building and you have a lease, you really want to put a good guy clause in there. Good guy means that you can get out of the lease in a designated time period. Example, 6 months. Because if you have, let's say you have a 10-year lease, but a good guy clause for 6 months or a year, whatever, you can get out of the lease. You don't have to go the length of the lease. Without the good guy clause, you're stuck with that lease. Now, obviously, there's no advantage to the landlord to give you that, but some of them have it. And when you're negotiating for a lease, you should always ask for it. As a new buyer, you should ask for it, because many times the lease that the seller has will have to be changed a little bit and often add on years, at least 10-year lease. And most leases don't have it. Most leases are assignable, but then you need the 10 years, and then the landlord says, well, we need 10 years, we're going to rewrite the lease. You don't always want to rewrite it, because it could be a great lease, especially if the lease has a good guy clause permitting you to leave the lease early. That's a very big deal. Now, I'll give you an example. We have some doctors that have an office. They want to buy an office and move it. They really want the records, but they want to keep the patients on location for a few months at the present office and slowly integrate them into their office. they really don't want to pay a double lease. But if it's for a few months, it's acceptable. And what happens is the patients come in and the doctor has 5 years left on the lease but has a good guy clause, they'll exercise the good guy clause. So the buyer of the seller of the dental office can get out of the lease, and the buyer could slowly integrate the practice into their practice. This usually works better with practices that are relatively close by, within a few blocks away in the city, within a few miles away in the countryside or suburbia, usually a 5-mile radius. So the opportunities are great, and I've just had quite a few of those that the seller really didn't want to do just a record sale. They wanted to sell their whole office, the equipment and everything, get top dollar. And the buyer was willing to pay that top dollar if they had a good guy clause and keep the seller on location at the present office for, let's say, 6 months, 7 months, and then start informing the patients of the new office, slowly integrating the patients. Now, if the seller is going to move with the records, move with the charts, that's the best scenario. The buyer wants the seller to stay on. And often sellers may not, may like that, depending on their age and so forth. But sometimes you get younger sellers, and they just don't want to be burdened by an office. Or you can have a situation where certain circumstances are such that the buyer's younger, want to get out, but don't necessarily want to stop practicing right away. They just don't like the management end of dentistry. So that's what we have here. Get that good guy clause. Now, you'll talk to your attorney. If the lease doesn't have it, it could be inserted on the new lease. You can't arbitrarily just put it on there. You've got to have a lease that has it there or negotiate it in. And there may be certain concessions if it's not in that you can give the landlord to put it in. So it's something to think about. It is very, makes your office more saleable. Definitely more saleable as a seller. All right, so remember that. The good guy clause, very helpful. Try to get it on the lease. Even if you're not thinking about it now, think about it when you sell your office in 10 years, 20 years, 30 years. The lease should ride with it. So speak to your attorney about that. Read over your lease. You may have a lease in there now. Some of the major cities have that. But it's something you should fight for. And we're having buyers that are really looking for records that don't mind buying an office and paying top dollar with the equipment and everything, keeping the doctor at that office, getting the doctor to move over to their office slowly, and it seems to be working out well. One buyer in particular want that specifically. She says, I'll pay top dollar for the office and all the contents and everything, as long as they're a good guy clause, and I can eventually move the patients out into my practice if it's in close proximity, and then the seller would come along with it. All right? Sounds great. Thank you so much for listening today. Everything you're about to hear, as you know, is not for legal or business advice. It's strictly for entertainment. Now, we have new practices coming out all the time, and that goes on our special in-house list. You can get that list if you sign up with us with a non-disclosure agreement. Thank you so much. Bye now.